At the Rosel Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend high blood pressure and cardiovascular problems on Wednesday, May 15th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit roselcare.com.
The information provided on Dr. Tom Rosel Live by Dr. Tom Rosel DC, interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey everybody, welcome. Dr. Tom Rosel here. We have a great program for you. We're going to continue the talk a little bit that we started about 2 weeks ago on cardiovascular disease, all leading into an in-house program at the Rosel Center for Healing coming up in May, and it's going to be around the 15th, but we'll give you the exact process on that in just a minute. Listen, the number one problem in this country relative to mortality and other conditions is the heart and what happens to it. And most of us don't really understand it because we're imbued by advertising, if you will, and manipulation and things of that nature. So when that's the case, where are you supposed to get the information? How are you supposed to know what's really right and what isn't true and what's being put upon you? And I'm going to straighten those things out just a little bit today. After last week's program, we were talking high blood pressure and how it could do damage. And somebody sent a note out to me, and a longtime listener, and asked me, well, what about low blood pressure? And we're going to touch upon that a little bit today. And by the way, those of you who continue, and I hope that all of you do, go into the live stream afterwards, we're going to talk about the different signs relative to your earlobes and other facial recognition that suggests, that indicates and points to the fact that you may have significant problems that are coming about with your heart and your cardiovascular setup. So let's get into this a little bit. One of my favorite laboratories that I go to is the Cleveland Clinic, and they are renowned for their work in cardiac health and so forth. And we want to really dig into that. So often you go into your physician's office and they're well-meaning guys, but they're duped like you are sometimes, and they follow standard of care, whatever the hell that means. I'm not sure, but that's what they do. And you're not a textbook. You're not some laboratory rat. You are you, and you have to know what the parameters are relative to how you determine risk levels. We know right now that cardiovascular disease, as well as cancer, by the way, which we'll get into at some other point, is on the rise exponentially, much more so than it's ever been. Could it be related? Could it maybe related to what we just went through over the last 4 years with COVID and vaccines? Well, listen, setting the terms aside, we know that the vaccines increase the risk of pericarditis and myocarditis and clotting factors, in the blood. So if that's the case, if that's the deal, so shouldn't we really be able to determine what's going on with our health and just doing a 4 or 5 blood test typing, total cholesterol, triglycerides, HDLs, LDLs, and leave it at that? And maybe they'll do a small molecule called coronary C-reactive protein. Well, when we do the in-house program, I promise you that we're going to get into this in depth. We're going to really pick through it. I'm going to show you. And matter of fact, why don't you, when you come that night, bring any lab work that you have with you, and I'll tell you what it is. You can ask me a question. What does this mean? What does that mean? And we'll go through that very, very accurately. Dr. Stephanie Pina, who's a naturopathic physician, will be my co-presenter, but I'm going to handle a lot of this chemistry for you so you really get it and you really understand it. So, according to, the renowned people at the Cleveland Clinic and experts, if you will, in cardiovascular health, let's talk about a couple of things that they put out there and what they actually test. And when we do these tests in-house, we make sure that it's all encompassing, because I promise you, just a measure of your total cholesterol is not enough. Just a measure of your triglyceride is not adequate. When you look at the good guys, supposedly the HDLs, high density lipotrophin proteins, that's not enough. Those are supposedly your good guys, right? That protect you. And then you got the bad guys, the LDL, which are the low density lipotrophic patterns as well. So if that's all they did, what does that tell you? And well, I'm here to tell you not a heck of a lot of anything. It just tells you your cholesterol's up a little bit. But again, when I was in school back in the day, over 4 decades ago, I mean, if I was coming close to 4.5, maybe more than that, coming up to, we won't go there. Total cholesterol normal was in the neighborhood of about 230. So why did they stop dropping the markers down? Well, some fool decided that the amount of cholesterol, the total amount of cholesterol in your body was not okay. And if they could knock that damn thing down to zero, then they'd be a whole lot happier. The problem is that cholesterol is necessary for so many side productions, including your hormones and your brain function and your energy levels and so forth and so on. So if you knock it down, you're going to go down the tubes. If you knock it down, you're going to take away the chemistry that your body needs, your muscles need, your energy cycles need, and so forth. So let's just talk about those a little bit today and see if we can put some meaning into this stuff. So your total cholesterol, it just simply measures your overall cholesterol in your body. Listen, I have patients, and you heard me say before, that their total cholesterol is close to 300. And your doctor would probably lose his mind. And in these people, they have a genetic trait and another allele, if you will, that doesn't allow those cholesterols to do any damage to them. And that's for a lot of different reasons that we could spend like 4 programs in telling you about that. But understand at least that concept just for a minute, that it's not necessarily a problem. You need to have it. Triglycerides assesses the fat levels, if you will, in the blood. Now, triglycerides don't necessarily stick to anything. If they get way too high, they're like mud. And here's one that I differ. They want you under 150. By the way, that's on your laboratory test. I like to see them under 100, but above 50. And so the blood is more viscous. It can move, and it doesn't, just kind of jam up. Now let's get into the good guys and the bad guys. The HDLs, the high density lipotrophins, have to do with your good guys. And these are the guys that are supposed to protect you. They're supposed to say everything's cool, everything's all right. But what they forgot to tell you is that there are really good protective guys and they're not so good protective guys. And the same thing with your LDL, the bad guys, the bad cholesterol, it's the same type of thing. These are the guys that can accumulate and stack in the arterial bed. And they're the sticky kind. But they're also the very, very sticky kind, and there are the not so sticky kind. And so how do we break it down? Well, your doc's got to run tests, and we're gonna tell you how these things actually work and why they increase and what causes them problematic situation when you come in and you join us at the Rosel Center in Fairfax in May. Now, the lipotrophic proteins, those LDLs, those low density lipoproteins, they've broken down into small a and a big A, and there's broken down into B. There's ApoB and ApoA, big and small. Your ApoB, and you can do this with your doctor. Say, hey doc, my LDLs, do I have more of the low density, lipo-A's? Do I have more of the lipoprotein B? And they're going to just look at you, most of them with big eyes, and say, well, we didn't check for that. And the next question you should have is, why not? Why didn't you? Isn't that really what tells me how much of a risk I have of arterial plaquing? So lipoprotein small a is associated definitely, absolutely with increased heart risk, because those are the bad guys. Those are the guys that are going to stick, all the way around. You get a little bit of inflammatory action. These guys are sticking all over the place. Your apolipoprotein big B, and it's called ApoB, is a protein found in the bad cholesterols, but they really are inflammatory molecules. And those are the things that you have to know. So the question then becomes, why are they inflammatory? Why do they cause other problems? And we're going to tell you all about that as well. Fibrinogen. if you think about fibrinogen, think about fibrous connective tissue, okay? Fibrinogen, fibrous, scarring, tough, tight, fibrous connective tissue. And they're a clotting protein in the blood. So if you didn't do anything else and you did that test, fibrinogen, you would find out whether or not you have all those tough little fibers in there. If you visualize these very minute, very almost undetectable fibrous areas making the interior portion of your arteries not so smooth, that's what this guy is. And things stick to it. So you have those things, right? So now we have this cholesterol, and we're breaking it down into this lipoprotein small a and lipoprotein big B, fibrinogen. And then there's one that most docs, except for a handful that really get it, don't do. And it's called an amino terminal like endpoint, amino terminal, pro-brain neuroradicate peptide. And it's abbreviated NT/pro big B, big N, big P. It's a protein that's produced by the heart and increase your risk dramatically for heart failure. That means that muscle ain't going to work, and if that's there, you got to figure out what to do about it. That has to do with mitochondria function. That has to do with oxygen transport and elimination. That's making sure that the right energy sources are available and so forth. So then we want to know, you remember we mentioned just a little bit about inflammatory pathways? We want to know about those too. We want to figure out, okay, how do we know that the body's inflamed? Because you could have a lot of this stuff, and if your inflammation is low, then things may not be as bad as, what you think they might be. So indicators that your doc should run relative to measurements of inflammation is something called small molecule CRP. It's also known as coronary CRP, is small density, small molecule. These are the guys that suggest that there's a huge amount of inflammatory reaction. Now, again, when we do this in-house program, we're going to really get to the substance of this stuff, and we're going to show you all about it. Your MPO. Now, I want you to look like Mickey and Peter and Othello, MPO. In capital letters, what it is myeloperoxidase. And that's another indicator of inflammatory responses. Now, the other thing that you have to test for, if you want to know what your cardiovascular risk is, something that you would measure your potential, if you will, to diabetes. And that's what we call A1C hemoglobin. And what that is a 3-month measure of sugar within your red blood cell. And it's important. And if you're in that pre-diabetic stage and you got these other markers up, you're at a higher risk. So now you have a choice, right? You want to take drugs for the rest of your life and knock all this stuff down and have the side effects that are compounded and stacking? Or do you want to change your lifestyle a little bit? And you want to start doing the things that you should be doing? And we're going to teach you how to do that. And, we're going to tell you how pain also, chronic pain patterns that we kind of go, that we ignore, that we just throw aspirin after it and so forth. So chronic pain patterns and how they potentiate this stuff. And if you just kind of put up with, well, we'll go over that and we'll let you ask the questions that you need to ask and we'll go through it. Now, another one, substances that we have to be aware of, if you will, is something called homocysteine. Now, homocysteine is an amino acid, and it's really important. If homocysteine starts rising, then it's suggestive that your B12 and your folate, not folic acid, but your folate levels aren't adequate enough with B6, vitamin B6, and it's a peroxidase form. And this stuff goes up and you get high with this stuff and your arteries are on fire. And you got to be able to knock it down to the way, you're safe. And we'll talk about that and why that happens and so forth. And then there's something called TMAO. And it's triethylamine N oxidase, and that's the word. It is produced by your intestinal tract, your gut, and the breakdown of foods and so forth. Also, dramatically increasing your increasing your risk for this kind of nonsense that's going on. So we have to look at all these things, and we have to order the test that makes sense. not just what your total cholesterol is, your triglycerides are. And we're going to look at your family history. You might have that genetic piece that says, no problem. You also might have a genetic piece that says, even if you keep them under control, you may have a problem. And then you better do other things to bring it down. And we're not going to talk about hard chemistry. There are things that you can do proactively. There's things that you can make sure that your body's doing in a preventive pattern. We'll talk about those things. So, when we order something, we order all those tests, and actually we order more than what we just talked about. So it's really important that you understand the interrelationship of these blood tests. And I want you to know more than your GP does. I want you to know more than your internist does. I want you to know as much as far as what these things actually show that your good cardiovascular guys do. Now, they have more experience. They'll be able to spot things much more readily, but you should know. You shouldn't go in and say, yes, doctor. Yes, doctor. No, you ask questions. You got to be a bad guy like me. I go in and I don't even tell them who I am, and I want to see what they do and what they know and, go from there. But look, the bottom line is that you have to have the data, the information, and look this stuff up. Remember, I said, challenge me. Go into the different platforms and try to find out what these bad guys actually are all about, where they come from, and what's your lifestyle. You have a checklist that you go through. You should, and we're going to, give you those things. We're going to talk about, cardiac enzymes, if you will, cardiobiomarkers is what they're called. And, these bioenzymes are proteins. Is what I want you to know. You hear the word enzymes, think proteins, and they help your body manage your metabolic pathways, particularly when it comes to what we're talking about right? So we're talking about blood clotting. We're talking about function with multiple pathways. And here's the interesting thing. If you have neurostructural musculoskeletal problems that will raise these enzymes, remember I said dysfunction and pain, it increases your risk in the cardiac arena, dramatically increases your risk. So you end up with, these unfortunate things like a heart attack, or heart failure, pain in the chest because the muscles are not doing what they're supposed to do, or you're getting these micro breaks that are in there. You can have heart failure. You have this thing called acute coronary syndrome. Have you ever seen that? Let me tell you what acute coronary syndrome means. It means you had a heart attack. It's myocardial, myo meaning muscle, cardio meaning ischemia. That means no oxygen to the tissue. And it's a result of something having happened, a clot or bleed or something of that nature. And I'm going to try to put that together for you and show you. And when we go into the live stream today, I'm going to talk about the different things that you can look at, from your earlobes to these little spider presentations that might indicate problems. Those little red spots you get on your body, and everybody says, the liver spots. Is it problematic? Well, I'm going to tell you that when we go into the live stream. So make sure you understand that you are your own primary doctor. You need to understand what your body's saying to you. And to put your head in the sand and say, well, I'm not going to worry about it, means that you're going to have a shortened lifespan and you're going to check out. Just remember, in the world that we're living in right now, we're seeing all kinds of things that are very unusual in the past and now becoming far more common. And so you have to measure the different pathways. We can get far more into what we were talking about a minute ago and start measuring things like, creatinine phosphokinase and myoglobin, and we can get into myocardial ischemia and what the indicators are for that. And what in fact did your electrocardiogram show? Do your doctors know what the splits mean? They know they have to do with potassium regulation in the body. If there's not enough there, it widens the different markers. If you have a left bundle branch block, are you salvageable? Can you live your life the way you're supposed to live it? Well, the short answer is, yeah, you can, but you have to know what the guidelines are and how do you make it better, because you can always, always, always make things far better than you would possibly think that you probably could. But, if you've had any chest pain and you kind of, put it off, ladies, if you get pain between your shoulders that seem to start from the front, that's your indicator for some reason Women, it goes to your back. It goes into your shoulder area. Do you feel nauseous and dizzy? Do you have the profuse sweating? Do you have shortness of breath? All those things can be indicators of a cardiovascular episode. And wouldn't you like to know what you can do to fix it? Wouldn't you like to know what you can do to make a difference? I know I do, and I would. And, I'm the guy that is on, the other side of this thing. So if you want to make a difference, I think now's the time. Now's the time to learn what you can and what you can't do, and maybe really put it all together. Look, we're in a place of the more you know, the more you can be proactive. And I don't know about the rest of you, but I sure want to be proactive about my health. I want to be able to take control. I'm not the end all and be all, but I'm the guy that, begins to make observations. I look around, I kind of check things out. I see, is this right? I ask questions. I ask the doctors hardcore questions, and I do it gently most of the time, but sometimes you have to be a little bit more direct. But guess what? It's your machine. It's like you own the car. You get to ask the mechanic things that you should know about. And if you don't, your car's going to break down. If you don't pay attention to the car is not going to run anymore. And then you got to call the junk man. Well, we don't want to call the junk man on you. We want you to have as much data and as much information as you possibly can. And then once you have it, here's the deal. Once you have it, now it's up to you to make a difference. Now, I don't know about you, but doesn't that make sense? That you want to make a difference? I think so. Next time you go and you want to have a complete cardiac exam, you want to have an echocardiogram done. Even maybe if you're having some real problems, if anybody told you that you might have an aneurysm, you do something called a transesophageal echocardiogram. You want to do an exercise stress test. If it's really suspicious problem, you might want to have an angiogram, but for my world, that's the last thing that you do. But you want to run these blood tests, and you want to know what your body does under stress patterns. If you don't do that, you're going to have a problem. You may end up dead. And we don't want you to do that. We want you to hang around as long as you possibly can for the full potential of your body. You're getting into those years. I went to school at Kent State University in Kent, Ohio, and many, many, many years ago, they did a study with guys who had strokes and repetitive heart attacks, and some of them had 2 to 3 of them. And all they did once their doctor cleared them is they started them walking, and they walked maybe 50 feet because that's all they could do. Then it was 100 feet. Then it was 50 yards. Then it was 100 yards. And then over a period of time, they got a lot of these guys walking a mile. Maybe they got 2 miles. And I'm going to tell you all about that when I see you in-house. We're coming up to the place of the show where I'm going to tell you, don't go away. Join me on live stream. And we're going to give you a whole lot more information on the physical signs of cardiovascular problem. Remember, I love you all. See you in a couple minutes.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums. Temporomandibular joint disorder is a very painful disorder, which only a skilled neuromuscular dentist can diagnose and treat. If you're in pain and suffering from TMJ, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMJ and how Dr. Michael Chung DDS has successfully treated patients. Visit softtouchdentalcare.com or call 703-319-6990.
At the Rosel Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend high blood pressure and cardiovascular problems on Wednesday, May 15th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit roselcare.com.
This is Dr. Tom Rosel. After 43 years of practice and over 1 million patient visits, the Rosel Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at roselcare.com. That's roselcare.com.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.